then making them work isometrically, and then a passive stretch. So it would be a hold relax, because the intent is we don't want massive contraction back more and more into extension. We just want them to hold us while we pull it into flexion. So it would still be a hold relax, but it would probably be a hold relax stretch, then a hold relax, and then try and get the agonists to work, because they're not capable of working at this moment. So we've got to marry everything together. And this is what we can do in a very simple way here. So here's flexion. I'm going to flatten the lordosis best I can. Then I'm going to sort of take this up so that I reach the barrier of the lack of flexion at a particular joint here. Then I'm just going to use my knees on the patient's knee. I'm going to come around on this lower lever, and let's say it's 3-4, so that I've got to sort of control the 4 and the 5. I'll put my hand around here like this, put my other hand, just using my thumb, if I could get hold of this like this would be the ideal, and then I'm just going to feel out what happens when I flex at this particular joint. And she's going into a little tightness here. Is that sore, or are you just doing that?
No, it's just...
To be obstructive.
No.
Okay, all right. So I'm just coming around here, and I'll get into that joint there, and now I can do it as a pure passive movement, which would be this, and I'm pulling round here, but I'm letting my body work with the knees a little bit as well. So I'm bringing in a bit of flexion of the hips, which goes as a pattern with flexion of the spine, and just pull around like this. And if at any stage I felt that Anne was giving me a little bit of reaction there, I could just stop and I could just say to Anne, now, can you just hold there? This is what, and she's moved a little bit now, a little bit less than this, just exactly react to me. So this is the hold, and now I'm increasing this. I'm trying to make these, now relax those muscles. Okay, now let me see if I can take it to a new point. Just relax a bit. Now she's gone into a bit of spasm again. Okay, hold there. And so I'm now trying to flex as she's trying to stop me. And relax. Okay, let's go a little bit more. Okay, now let me see if I can stretch it around here. So I can do this as a perfectly good stretching procedure inside lying.
You're making the extensors work.
I'm making the extensors work when they need to. If they're not coming in, I don't particularly do this. So this is a fairly early starting, very controlled procedure, so we can see what the reaction is like. It may not be entirely successful, particularly with the women working on a big man, so we need to sort of give you a little bit more advantage, which we will do in a moment or two with some different techniques, but this is a very useful technique. On the table that we designed in Canada, we have all these kind of things that swing around, so we can just sort of let the table do a lot of this work and have the axis of motion across the table. I mean, there are different ways of doing this, but essentially it still gets back to we've got to feel that movement and then produce that kind of thing, sensing the end feel and changing the end feel in relationship to what we're doing. Now then, with Anne, because she's so brilliant here, it could possibly be that I would go around here and I could say to her now, and this would be using what Kent told us would be the contractile, can you try and pull your knees up to your chin and at the same time tuck your tailbone in? Just come on. And so she would try and do that. So I'm trying to get her to do an isotonic contraction. If she doesn't achieve it, it'll end up with no movement. But the intent is to get movement. And so we can now come trying to get the abdominals to sort of work a little bit to enhance this action, because after all, she's got to do this as some exercises. So that is the way that I think we could start with flexion. Now, the next thing, and I'll show you 2 or 3 techniques, because then you can just practice them, because we don't want to keep going back to the table, is can you lay on your fronts, Anne, please? And I'm going to have my table, which is adjustable, so I can pull up this section here like this. So it's like this in the middle. So we've taken her into flexion, and we can simulate it with this. Can you come over a little bit to me so that I'm not stretching over? So now this would be a sort of semi-specific technique at the best. I can put my hand on the caudal bone. I'm going to put my hand under here on the cephalic bone, on the rostral bone here. If my splint presses into you, just let me know. And now I can do a movement where I'm just pushing down. So this hand is pushing down, and I'm trying to separate the spinous processes in this way.
The top hand is stable.
It's just stabilizing the cranial segment. Yeah. So we come down like this. Now then, here we've got a perfect example of where we can use the hold relax of the antagonists of flexion, which are the extensors of the spine. Anne, can you just hold? You see, now here we've got another example of someone who is as intelligent as Sammy, because she knows, and she's just putting exactly the right amount of work on. She's not producing any more extension or anything. She's just holding, and this is what's so good about this. Now relax. Now I can feel it relax, and I can feel it go down.
And you're doing it, and you're having her hold. You're putting your resistance
Yeah.
to your left.
Yes. Yeah. Now here's an interesting thing. You know that occasionally with certain movements we use eye movements to augment, and that was a thing of facilitation too, but it was a thing that went back a long way as well. And also that we can use breathing patterns. And we tend to use breathing to augment the contraction, but it's an interesting thing in this way. And can you just take a breath in? Now, what I want you to do is to just breathe out. And as she breathes out, I feel that actually this comes a little bit into lordosis. Now breathe in again. And as she breathes in, because of the movement that takes place on the sacrum in this movement, and I don't know whether this is kind of a sacral movement or the fact that the chest pushes up here and pushes the spine up, okay, that we find that as she breathes, I can get a little bit more at the relaxation phase of going into the flexion there. And you'll find this also when we do distraction. It's a funny thing. Okay, just breathe out. And as she breathes out, I feel this wants to come back into the lordosis, so I just hold it a bit. Now breathe in, and at the breathe in, I can stretch down. So be sensitive to what breathing does as well. Because all of these things help us when we're trying to get a maximum contraction. So these are two ways of doing flexion. Now then, the third way, which is probably the most useful in terms of if you're dealing with a big man with very tight, you know, this kind, all right, with the lordosis, you say bend forward, okay? We've obviously got very tight muscles here, and this might not be subtle enough, and it may be that we've got to try and just stretch over several joints, in which case we're using semi-specific techniques. I mean, several joints isn't like this, but it's over a section of the spine. So can you stand up a second, Anne, and come to the end of the table, and what I'd like you to do is to lay on the